implementation of infection control is mandatory in all hospitals. You take any accreditation process, whether it is the Joint Commission International, whether the National Accreditation Board, they all insist as a mandatory requirement in infection control program in every hospital, be it a 2-bed hospital or a 1,000-bed hospital. You need to have in place a documented infection control program. But the problem is, as usual, the questions which are asked is when you settle a written program which mandates formation of a team, which formates a periodic meeting, there is an interaction between all specialities, including the medical specialities, the surgical specialities, the housekeeping, nursing division, the sterilization and disinfection, including, monitoring how you use single-use devices. The question asked is, what is the return on investment? Especially when you're working in a corporate hospital, when you're going to invest in putting in place an infection control program which costs money, the challenges would be how do you account that if I'm going to pay 5 lakhs a year on this, what does it show at the end of all this? And that is what is very difficult to convince people in most hospitals. What is the result? We know that it is being shown by studies in the West that putting an infection control team and making sure there is an infection control nurse or a professional for every 100 beds gives a significant savings. This is in a public system where the patients, the healthcare delivery is different, the government pays for the system, but in a private hospital where patients pay from their pocket, the patients pay for their antibiotics, the patient pay for their surgery, the bed. It is very difficult to show that by putting in an infection control system in place, you are saving money for the hospital. It just doesn't make economic sense. So this is the main challenge, ensuring that people understand the importance of infection control and how it impacts on outcomes, better quality of health delivery, all that to make sure that people who are doing it understand is what the main challenge is.